All right, everyone. Let's get started. Good evening. My name is Scott Barnes. I'm one of the program directors of the Master of Speech and Language Pathology program here at Macquarie. Thank you very much for attending the Speech Pathology and Audiology Information Evening this year. I'm sure this is something that a lot of you have been working towards and thinking about. And it's really nice to see a lot of faces and bodies in the room tonight. Okay, so first I'll just start by doing a bit of housekeeping and talking about how things are going to be organised this evening. We're going to have the formal presentation part to begin with. So I'm going to present the speech pathology portion and John Newell is going to present the audiology portion. We'll then have some question time where you guys can, ask questions, quite strangely. After that, we'll break out and have some more informal discussion. So people who are interested in audiology can stay on level 1 in the foyer here. People who are interested in speech pathology can go downstairs to the reception area on the ground floor, and people who are interested in both can toggle between them. In addition, tonight we also have some wonderful student volunteers who have given up their time to talk about their experiences so far in the program with you guys. So make sure that you do seek them out and chat with them about how they've been going so far, what the program's like, and they can be a really useful source of information for questions too. So don't just rely on the staff for that. Okay, so I think we can get started with the presentation portion. Okay, so now I'm going to talk about the Master of Speech and Language Pathology at Macquarie University. We also have a couple of staff here in addition to our students. So our students are down the front here. Alejandra, Harriet, Andrea, Alana are in the front row. Another program director for the MSLP is Dr. Elizabeth Harrison. And this is some clean-cut young man. I'm not exactly sure who his identity is. Anyway, so you can find us to discuss the program with us when we break into more informal talk. Okay, so one question that you might have is, why do we have a Masters of Speech Pathology here at Macquarie rather than a bachelor's degree? Masters programs in speech pathology is something that has emerged probably over the last 20 years and are sort of the standard internationally, but have been relatively new in the Australian context. One of the key rationales for having master's programs is that it allows graduates from other disciplines to become speech pathologists. So here at Macquarie we've had people with a variety of different previous professional backgrounds and undergraduate degrees, art, music, international relations, nursing, etc., 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 come and become speech pathologists, use those experiences that they've had elsewhere to become well-rounded professionals and people. Okay, so master's programs in speech pathology allow the profession to become as diverse as it can be. So, as I mentioned, this is also the standard in other countries. Places like North America in particular have had master's programs for a long time, and that's the kind of default setting for those. Okay. In addition to speech pathology and audiology, Macquarie also has a variety of other graduate entry degrees, professional degrees, so things like psychology, physiotherapy, and neuropsychology. So, one of the key characteristics of the MSLP is it means that you can practice as a speech pathologist in Australia. Okay? The master's program here is accredited by the professional body for speech pathology, Speech Pathology Australia, and once you meet the requirements for the Master of Speech and Language Pathology here, you can become a practicing member of SPA, which enables you to work as a speech pathologist in Australia. In addition, as I mentioned before, master's degrees are the default in other places in the world, so having a master's in speech pathology can make it easier for you to work overseas. And Speech Pathology Australia has different sorts of recognition relationships with other professional speech pathology bodies around the world. So places like the USA, UK, Canada, New Zealand. I should also mention too that these slides and this audio recording is going to be available after this session, and simply by registering you will receive those things. So don't feel like you need to madly take notes. Okay, so what are the prerequisites for the Master of Speech and Language Pathology? For people who haven't done a university degree in English or for whom English isn't their first language, there are English language requirements for entry to the degree. That's what the IELTS there denotes. We're also expecting a minimum GPA of a credit from an undergraduate degree or another postgraduate degree. Okay? And that's a really core minimum requirement there. Unlike other speech pathology degrees, our prerequisites focus in linguistics and psychology. Okay? Linguistics and psychology are really, really important for the design and the content of the MSLP, so it's vital that you have a sound grounding in each of those disciplines. Now, you can find really, really specific information about each of these requirements by following that link there. So, for those of you who are in the Bachelors program here, the Bachelor of Speech, Hearing and Language Sciences, you will have been doing all of these subjects. For those people who are coming from another university, for your information, we're looking for core linguistic studies at an introductory level, introductory psychology and statistics. We're also looking for slightly higher level psychology as well, particularly developmental psychology, psychology relating to learning and behaviour, and also some more specific technical linguistics knowledge, so in phonetics and phonology, as well as language acquisition and speech physiology. Okay? So for people who are coming from other institutions, what will happen with your application is that it will be assessed to see if you've done equivalent studies to these subjects at Macquarie. The Master of Speech and Language Pathology is structured around an academic and a clinical component. Okay? Together they form a 64 credit point master's degree, and the workload in this program is quite high. Okay? So we're expecting this to be essentially a full-time job. Yeah? It's not going to be easy for you to work part-time, work large hours while also completing this degree. Okay. As well, for the MSLP, unlike some other master's degrees here at Macquarie, we follow the standard semester structure. Okay, so you'll have that continuity there with mid-year and end-of-year breaks. Okay, as we'll see, some of your clinical placements will go into that time as well, but the coursework follows that structure. And if you're entering the program in 2017, it's going to be a minimum of 2 years to complete. Okay, some people might take a little bit longer, but most students will complete in that 2-year period. So starting in session 1 2017, you'll be finished by around the end of January 2019. Seems like so far in the future. I was caught in a meeting the other day referring to things that we needed to do in 2015. No, Scott, no, no, no. Okay, so as I mentioned before, the MSLP here is an accredited speech pathology program, and what that means is that the structure of the degree in terms of its coursework and clinical components are consistent with the competency-based occupational standards for speech pathology, or CBOS, which are basically the professional standards for speech pathologists. Now, in terms of what that content looks like, what you'll be studying, you'll be learning about the nature and causes of communication and swallowing disabilities, and really specific information about evidence-based assessment and treatment for those conditions. So that's the coursework component. With the clinical placement component, what's going to happen over the course of the program is that your practical demands are going to steadily increase. Okay? So by clinical placement, I mean supervised practice in a workplace with a professional speech pathologist. Yeah? Kids. So in your first year, in your first semester, you'll be doing a lot of observation, okay? Watching pediatric and adult speech pathologists in different contexts and, getting your feet wet in terms of speech pathology practice. In the second semester of your first year, you'll be experiencing slightly higher demands. Okay, so you'll have a weekly placement during semester where you go to a particular workplace 1 day a week. Okay, and you'll also have a block placement towards the end of the year or early in the subsequent year. This means you'll be working usually 4 days a week as a speech pathologist under the supervision of a clinical educator. These demands are replicated in the second year, okay, so you'll have another block placement in first semester, and then in the final semester, that's when the stuff really starts to happen, where you're essentially working as a speech pathologist, going to clinical placement every day, and getting ready to be a practicing speech pathologist in your own right. In terms of the clinical placements, this isn't something that you have to go out and organise yourself. You don't have to show up at Westmead Hospital and say, please, 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 let me come here. We do that for you. We have clinical education managers that will place you into a speech pathology context. We also have a variety of placement opportunities here on campus. So we have the Speech and Hearing Clinic, which is located downstairs, and Macquarie University Hospital. We've also got some places that we have relationships with. So Westmead is one, Royal North Shore, Central Coast, Illawarra. There's a good deal of flexibility in terms of the places that you can go. If you want to perhaps go somewhere rural to do a placement as well, we can organise that. Okay. It is also possible too for some international placements. Yes, that's still the case. That's a little bit more complicated, but is theoretically possible. So if that's something that you're interested in for whatever reason, please do let us know early on. Okay, so how do you get into the MSLP? So the core pathway for entry to this degree program is Macquarie's Bachelor of Speech, Hearing and Language Sciences, including those prerequisite units that I mentioned before. People who have other bachelor's degrees who have also studied the prerequisite units, or there's an alternative pathway where someone who has a different bachelor's degree can do the Diploma of Speech and Communication, which is an entry pathway to the MSLP. Like I said, we need a credit GPA. Macquarie is going through a transition with how it calculates its GPA, so most of you would have heard 3 GPA at some point. That's going to be 5 now, so that doesn't mean that you need to do really, really well in your final semester. It just means it's being calculated in a different way. And the slides have some links here to both the old and the new system. So what you need to keep in your head is credit. Don't worry too much about the number. Okay, specifically about the Diploma of Speech and Communication, like I said, that's for people who have different academic backgrounds, not for people who have already done prerequisite studies and want to raise their GPA. That's not what this degree is for. This one too, you can enter in session 1 or session 2, and the entry requirements are essentially the same as for the MSLP. So with this degree, we're really looking for people who will be very competitive applicants for the MSLP once they meet their prerequisite study requirements. Here's a little taste of what that diploma looks like. We've got some information here that you can take away and have a look at as well. There's also very detailed information on the website about this particular degree. Okay, so in terms of the closing dates for the MSLP and the diploma, as I'm sure many of you know, the MSLP closes on the 31st of October. The diploma is a fair bit later, but good to get in early and sort yourself out if you are thinking about applying for that degree. In terms of what your application will look like, this is something that you submit online, okay? There's no paper-based application anymore. Kylie, is that correct? Kylie's not here. That's fine. Liz has confirmed that is correct. So where you'll place all of the information about your previous studies. Another thing that we want there too is a personal statement from you about the reasons why you want to become a speech pathologist and any other information that's relevant to your application. Okay? So with this personal statement, you're telling us about your understanding of speech pathology in Australia, why you're interested in becoming a speech pathologist, and yeah, other issues that are relevant for your application. There's a good deal of flexibility here in terms of the information that you can present, and it's really up to you to think about what's important for us to know in terms of your application. The understanding of speech pathology thing is really, really important, just because we don't want people to get into the master's program and go, oh, this isn't what I thought it was, okay? It's really important that you know what you're getting into, yeah? So that's a really key point. Okay, so what happens next? So you'll submit your application, it'll go into a pool for processing, then we'll assess your applications and send out offers to you by early December, okay? There'll also be a response deadline with that as well, because there's lots of people who want to get into the program, as you know, so if you end up going elsewhere or decide it's not something that you want to pursue, it's important for us to know that so we can make offers to other people. Okay? So if you don't get an offer for the MSLP by late December, it's possible that you might get a second round offer with some of that attrition. It's important to keep track of your email if you haven't heard during December and January. Yeah? Okay. And similarly, again, we've got a response deadline for second round offers. Yep. Now, for those of you who do have a good GPA, know this is what you want to do, it's a good idea to start thinking about some of the practicalities involved in this degree. Okay? So in order for us to send you out onto clinical placements, there's a variety of New South Wales health checks that need to be undertaken. Okay? So things like vaccination records, working with children checks, criminal record checks. It's good to get started on those now with a view to everything running smoothly come December and January. Yeah. And yes, the contact person for this information, if you do have any queries, is one of our clinical placement administrators, Virginia Gore. So please do get in touch with her if you have specific questions about those requirements. So, how does the job market look for speech pathologists? It looks good, yeah. There's plenty of opportunities for speech pathology work in and around the Sydney metropolitan region, and especially in places outside of Sydney in rural and remote areas. Okay? There is demand for speech pathology, and that demand is going to grow with different models of healthcare coming online, particularly the National Disability Insurance Scheme, and also the ageing population. Yeah? Okay? So job prospects for speech pathologists are very good. Okay? And we've seen this in recent years. By April of this year, everyone who graduated last year from the speech pathology degree who wanted to work had a job. Okay? So the job market is looking very good at the moment. Okay? So these are the kinds of sectors that you can expect to work in here too. That's sort of changed a bit over the last sort of 10 years, okay, with not-for-profit and private practice becoming bigger employers of speech pathologists. Okay, so if you want to know more about speech pathology, the Speech Pathology Australia website is the spot to go. There is a very useful and watchable video that you can find on this site here, so please make sure that you go and have a think about that with a view to your applications. And any further inquiries about particularly applications should go to the Linguistics Student Office. Okay? And I think that's me done.